stem cells and their related biologics are the most efficient at helping us heal and repair in the most restorative and youthful way. They're the most anti-inflammatory cells we have. They help replace and renew cells, and tissues. We have new skin all the time. Skin cells, we make new liver cells, that kind of thing. So our stem cells are important for that. But as they become less functional, I love to get a little help or give a little help to people who can benefit from it.
Do you want to wake up feeling like you're stepping into who you're meant to be, into the best possible version of you? What if I told you that the key to your best life, health, and happiness are all around you? You just have to find what works for you. I'm Hopeful Jasa, and I believe that there isn't just one way to live a healthy and meaningful life, and that all you need is a little inspiration to make changes that last from the inside out. Each week, I'll be sharing tangible tips and inspirational interviews to help you on your journey. These are the steps to take to improve your life and live with purpose. This is Hopeful and Wholesome. Hey y'all, welcome back to Hopeful and Wholesome. Today I have on the show Dr. Jeffrey Gross. He is a trained neurological surgeon that specializes in athletic injuries and spine procedures and offers longevity and biohacking consultations. He is board certified by the American Board of Neurological Surgery and is a member of several prestigious medical societies. He has written textbooks and articles, and he's achieved numerous awards over the past few years. And he is the founder of ReCELLebrate, focusing on anti-aging and regenerative medicine. The mission for ReCELLebrate emphasizes offering modern biochemical treatments and considering surgery as a last resort. And that is what we're talking about today, is regenerative medicine. And when I tell you that we have some mind-blown moments here, like y'all are going to learn so much about cellular regeneration and regenerative medicine that I feel like is really going to impact us in the long run. If we can spread the word on exactly what these regenerative treatments do, what they are, how we can find them and use them, your parents, your grandparents right now, and then us, like there's so many opportunities available to us where we don't have to have surgery. So get ready, take notes, and here, let's jump in. All right, y'all, let's jump in. I'm here with Dr. Gross, and I'm excited about this conversation because this is kind of a hot topic. I don't know. The regenerative medicine thing, I feel like, is a hot topic right now. And so I'm excited to get the expert opinion here. So thank you so much for joining us today.
Yeah, thank you for having me. Happy to chat.
Yeah. So I'd love to start out with just kind of getting into your story and how you got, I mean, obviously you're a medical doctor, but how you got into specifically looking at regenerative medicine in this realm.
Yeah, so I was practicing traditional neurosurgery of the spine mostly. I have a spine fellowship for well over 20 years. And I think there was growing frustration because I was one who was trying to avoid surgery for people unless there was no other option. So I wasn't, a very aggressive surgeon, but I noticed a gap. And to be fair, my patients noticed it too. And that gap is between non-surgical and surgical options for the spine. And this applies to other joints too, where patients will try therapies. They'll try natural anti-inflammatories or even pharmaceuticals, or they'll try, even some spine injections. If it's a knee problem, people try, cortisone type injections for the knee or what have you. But often those things aren't enough. They might be short-lived or they just don't help enough. But that doesn't mean people are ready for surgery. And we're catching these problems earlier. MRI is amazing. We can see inside the body so wonderfully. We can see quite a bit. So we're catching problems at an earlier stage. And people don't like to suffer. They want to be active. We want them to be active. We want them to use their muscles and stimulate their bone to have good bone density and be active and youthful. So my patients would come in and say, well, these things didn't work. And I'd say, well, I guess we should talk about surgical options. And they'd say, well, I'm really not ready for that. I don't want surgery. And I'd say, yeah, I kind of don't want to offer it to you. So they'd say, okay, doc, what about lasers? What about crystals? What about stem cells? And you hear that enough and you get bonked on the head enough and you hear it.
Do you listen?
And yeah, chance favors the prepared mind, right? I have an undergraduate degree in in biochemistry, in molecular cell biology. And even though I love that stuff and I whisked off to med school and residency and that was in the back of my mind, I kind of miss that cool stuff. I'm
Mhm.
a nerd of sorts. I self-admitted, and although others would call me that too. And I said, you know what? Instead of going to these annual spine surgery meetings where old people pat themselves on the back from academic institutions for doing the same thing for the last 60 years, I said, you know what? I'm going to go to different kinds of meetings. And I started going to regenerative medicine meetings and stem cell meetings and courses. And I started
Mm.
training and I started asking, what are the best practices? And I started to figure out how to put all that together. And about 6 years ago, I started doing it. And I did it for patients to have a new tool to offer them for their spines, but it has blossomed into so much more. And spine is now only a proportion of what I do. I treat other musculoskeletal problems and metabolic problems and inflammatory issues and things I didn't think I'd be doing, but I love it. So that's my journey. Sorry for taking so long to explain
No,
it.
it was perfect. It was perfect. I think it's great. It's a great starting point. I would love to know, just like you were saying, like you weren't exactly the most aggressive surgeon and it was kind of like your last resort kind of thing. When you decided to go this route and look at like stem cells, regenerative medicine, all that, did you get any pushback from, your colleagues in the medical field, conventional medicine? Like, is it something that's frowned upon in the conventional medical world? Like what is kind of the stigma?
Not directly. I didn't get pushback directly. In fact, most of my true colleagues, we have colleagues that are supportive and friendly and helpful, and then colleagues that are backstabbing, competitive, right?
Sure.
So and what happens is I have patients, and I'll see patients. We'll talk about it, regenerative medicine, and just for the purpose of this podcast, if we use the phrase stem cells, I'm not limiting that to stem cells. It could be any form of
Sure.
regenerative medicine,
Sure.
but stem cells is kind of the catchphrase.
Yeah.
So we would give that option. They would go back to see their regular doctor, and some of the doctors were like, "Well, yeah, if that's something you should be willing to try." So we get a lot of that, and then the other side is, "Oh, well, that's not ready for prime time."
Mm.
That's or you get the myths like, "Oh, it's
Mm-hmm.
illegal."
Mm-hmm.
Complete myth.
Yeah. I would
Yeah.
love to hear more myths. Please de-myth all of it. Debunk all of it.
Demyth it. Well, having stem cells is not illegal. They are not yet approved for marketing claims by the FDA.
Mm.
They're not to be delivered. What a clinician and a patient decide together with proper informed consent and pros and cons and approval, that's a sacred relationship, right? You have your clients, I have mine. What we talk about, what we do, that's in the best interest of that person.
Sure.
So the FDA does not, the word approved does not mean they tell doctors what they can and can't do.
Right.
Now,
Right.
health insurance companies use that to not pay for stuff.
Mm-hmm.
And big pharma and big implant companies that make metallic rods and screws and knee replacements don't want regenerative medicine coming and taking their billions of dollars
Mm-hmm.
away each year. So there's a lot going on. And now that I've said all that, I'll probably end up buried in the desert here in Nevada. But yeah, if I disappear, please
We
please
know. We
share
have the
this with
proof.
the
Yeah.
authorities. Yeah. Oh wait, it's the authorities that'll probably put me there. So be that as it may, I think the biggest myth is that the FDA controls marketing claims. So we can't make any claims that we cure or treat a disease or
Sure.
condition. Like a supplement company can't make
Yeah.
any claims,
Right. Right.
which is funny because doctors can't guarantee anything anyway, right? We can't
Totally.
guarantee results. We
Totally.
try like heck, but we can't
Yeah.
guarantee.
Yeah.
So the whole thing's kind of just, what it is, and we want to be
Yeah.
compliant. So,
Sure.
so that's the biggest myth. The other myth is, oh, you got to leave the country. No, you don't have to leave the
Mm.
country. You can do it right here. Well, why don't I hear about all these clinics in the US? Because we can't advertise. Google will not let us advertise. Facebook will not let us advertise. Why? It's not because it's not approved by the FDA for marketing claims. So it's kind of a cycle that it keeps us out of there. It's the
Ah,
political forces to keep us out of
right.
there.
That's so unfortunate. So which is seems so strange to me. And this is like, forgive me if this shows my ignorance because I don't know how it all works with the FDA stuff. But is it not strange that you're allowed to perform the tasks, but you're not allowed to advertise it? Like that doesn't make a lot of sense to me.
So marketing claims, like making a claim that A does B, cause and
Sure.
effect,
Sure.
is based on science. And we have
Right.
great science and literature behind it. But the FDA decides when there's enough science to their satisfaction.
And is that
So
subjective?
highly, and
Okay.
of course there are other outside influences,
Sure.
and
Sure. Sure.
so that's a big
Okay.
component of it.
That makes sense.
So is it, oh, could I put up a billboard that says stem cells may be helpful for you? Call us for more information. Yes, I would not be violating anything. But
Hmm.
Google is very Fed friendly. Facebook is very Fed friendly, right? They're going to do what the government tells them
Yeah.
to do.
Yeah.
They're
Yeah.
going to be super, super cautious. So we can't
Yeah.
advertise. So it's very difficult.
Yeah.
But that's okay. So you don't have to leave the country. The other myth is we're harvesting babies. We're not harvesting any
Hmm.
babies.
Hmm.
Crazy. We have donors who have, congratulations, here's your baby from your C-section. Hey, your umbilical cord, your placenta, your amniotic fluid, we were going to throw that away. Can we have it?
Yeah, I did that with both of
So
mine. Y'all can have it. Use it with
there
whatever you
you
want.
go. Yeah. So that's where the sources come from. And they're tested, they're screened for
Hmm.
problems and diseases.
Hmm.
And guess what? We get them from FDA certified and compliant labs, ironically. So
I was about to say the irony is just
yeah, well, yeah, anything government is probably has some irony in it,
totally,
right?
totally.
Yeah. So those are the big myths.
Okay. No, thank you for clearing that up. I appreciate that. And
Yeah.
I think so when you're doing this, and like you said, the stem cell thing is, kind of a all-encompassing term, but there's multiple things you can do for regenerative medicine. But I guess maybe if we're specifically talking about stem cell, what kinds of things are you like helping people prevent certain surgeries that they might have otherwise? Like what kind of things are we
Ah,
preventing from happening when we're using stem cells?
yeah. So the low-hanging fruit of what I do, I mean that the people with the biggest problems where we get the biggest benefits, and I have to say anecdotally because I can't make the claim, right? Is people with joint and spine problems. Those problems are usually pain and dysfunction from what is often called osteoarthritis, or what your doctor might dummy down as arthritis.
Right.
It may be called, if it's bad enough, bone on bone,
Mm-hmm.
wear and tear,
Mm-hmm.
age-related degeneration. All those phrases is the same thing. It's a wearing down of the cartilage surface.
Right.
And that wearing down of the cartilage surface is because the bone adjacent to the cartilage is no longer, those cells in the bone are no longer effective to produce and maintain the cartilage that it made in the first place. When you are a fetus and a young child, those bone cells that make cartilage, called chondrocytes, are healthy and active. And if you injure yourself as a kid, you heal it because your stem cells and your chondrocytes are so active. But as we're exposed to the world has pro-inflammatory forces, it has toxins, it has things in our water, things in our food source, pesticides, leached out food sources. We have nutritional gaps. You're nodding your head because you do this every day, all day, and I salute you for that. We have people who have accumulated inflammation, and with age and with this accumulated inflammation, and those are the same, those cells don't work anymore, and our stem cells are less effective at healing us because we have the blueprint to make that cartilage. We have the blueprint to heal that cartilage.
Mm-hmm.
But when that machinery is not working well, I seek to re-stimulate it. So we re-stimulate the bone by injecting the regenerative biologics right into the bone, right adjacent to the cartilage. Because remember, cartilage isn't very bioactive. It's a bunch of squishy proteins. Cartilage comes from a chondrocyte cell in the bone. So it's a bone problem, and the solution's in the bone. This is proven by some wonderful work in France, because most of the good science comes out of Asia and Europe because we're
Mm-hmm.
so behind here.
Mm-hmm.
So, and they've shown, and I have examples in my own practice where we've had significant improvement, avoided surgery, and even done some MRIs after the fact by a number of months, and shown an increase in the thickness of the cartilage
Wow.
that was wearing down.
That's pretty
So we
cool.
can help you. We can help a person do the healing. You have the code, you have the blueprint. Your machinery's all gunked up, and that's
Yeah.
what we do.
Yeah. Can you explain a little bit more? And I probably should have started with like, what is a stem cell? But can you explain a little bit more about like, so you're saying, our stem cells aren't doing what they're supposed to do kind of thing. Or is this like a result of
like you talk about toxin stuff. Are there other things that we're doing to kind of make these stem cells not do what they're supposed to do besides just the toxic world we live in?
Well, yeah, some people are smoking, some people are
Mm,
drinking too much, some people are not eating well or getting too many vegetable oils and things we shouldn't be having. So it's usually what we ingest by breathing, eating, drinking. And then there are I could say people who don't really exercise
right.
or don't work towards an anti-inflammatory lifestyle,
Yeah.
an
Yeah.
epigenetic, health span lifestyle.
Hmm.
All those things work against us, and our cells and our stem cells become less functional. We have more senescent or age cells, and those are also called, as you know, zombie cells. And those cells produce leaky pro-inflammatory proteins. They gunk up things, they take up resources, and we really need to kill off those zombie cells. So you see a lot of supplements that talk about that, helping to do that. But stem cells and their related biologics are the most efficient at helping us heal and repair in the most restorative and youthful way. They're the most anti-inflammatory cells we have. They help replace and renew cells, and tissues.
Hmm.
We have new skin all the time. Skin cells, we make new liver cells, that kind of thing. So our stem cells are important for that. But as they become less functional, I love to get a little help or give a little help to people who
Yeah.
can benefit from it.
Yeah, yeah. Are there other ways, besides we're talking about stem cell therapy, like are there other ways that we can restore function to stem cells, or is it one of those things like once the function is gone, it's you have to get, you know, the help?
No, there are other ways. We talk about nutritional gaps and proper supplementation, anti-inflammatory supplements, getting your microbiome where it needs to be, getting, rid of toxins, detoxifying, exercise, yoga. There's some wonderful papers. If you search PubMed on yoga and stem cell
Oh,
activity, and
nice.
and and a lot of it may deal with not only the stretching of the fascial tissues, but
Mm-hmm.
the muscles release the myokines, which are anti-inflammatory and pro-healing. You can do breath work and good breathing and restorative sleep. You could do hormetic activities like Finnish sauna and
Mm-hmm.
release those survival heat shock proteins, which
Mm-hmm.
are found also in stem cell and stem cell vesicles. So yeah, anything you might have talked about or read about
Yeah,
for
yeah,
health, fighting inflammation is
yeah.
also helpful for your own stem cells to
That's
help
amazing.
them function better.
Yeah, that's amazing. And I think that's something, and yeah, we talk about all those things in the show all the time, but like specifically, like, oh, this is helping your stem cells. That's really cool to know.
Yeah.
So
Yeah.
we were talking about regenerative treatments, because you said like there's multiple types. What other types of things are
Yeah.
you doing to help with as far as regenerative medicine?
There are three main levels of regenerative medicine. The bottom simple level is called PRP, or platelet-rich plasma, and this is usually drawn from your own blood and spun in a centrifuge in a doctor's office, typically for a tendonitis, like a tennis elbow, an ankle sprain, something like that. Usually you go a few times, and that's fine, and it helps many times. In fact, even though it's not approved by the FDA, some insurance companies are paying for it because they
Nice.
they
Yeah.
finally paid attention enough to the dollars to say, oh, that surgery is more expensive than a couple
Mm-hmm.
PRP treatments.
Mm-hmm.
Plus, it's your own blood. So that's the lowest level. The next level up is stem cells, and that's a two-part. Part one is you can get stem cells from your own body. The best ones are in the fat and bone marrow, probably bone marrow best. Now, I don't use adult stem cells often because we can get the younger
Mm-hmm.
donated perinatal around the time of birth, those products, those cells with ease, right? It's
Mm-hmm.
otherwise going to be thrown away.
Right.
And those are most youthful, most active, and don't require to be harvested from the patient that
Right.
we're giving them to.
Right.
So when you take your car to get the oil changed, you don't put the old oil back in. So I'm a big fan of young, fresh oil. so,
That makes sense.
so I love the perinatal source. Now, having said that, there's a third level that I think is advantageous. And this has been available for 5 to 6 years now, but it's the hottest of the hot. And these are called extracellular vesicles, or exosomes, you may have heard. And what they are is we figured out that if you get stem cells, so if I give you some IV stem cells today, they'd be gone in 10 to 14 days, but their benefits would last weeks and months. Well, why is that? They're gone. Well, because they have delivered cell signaling vesicles to your cells that have imported by endocytosis, if you remember that word from biology, and they take in the small microRNAs from the stem cell. They take in the growth factors, the heat shock proteins, the survival, the anti-inflammatory influence on your genes. They don't change your genes. They just say, hey, we're going to tap into your anti-inflammatory genes, because anti-inflammation mode is the most optimal functional mode, the restorative mode, the youthful mode. So the stem cells deliver exosomes. All cells make exosomes, but the stem cells, the good exosomes, are delivered to your tissues. They penetrate tissue better. They last longer. They're small enough to get through the blood-brain barrier and get to your brain and nervous system. And they're half the cost of stem cells. So stem cells is more of the delivery vehicle, and the exosomes are the actual stuff. And we can get concentrated exosomes from stem cells from the same perinatal sources that we got the stem cells. So I'm a big fan of exosomes. They're a lot easier to handle and use and put to work. And we've had great results.
That's awesome. So is this something where you have to do, because you were saying they've put the stem cells in it and then, they're gone after some time. So is this something like if somebody is every time like bone on bone, their knee or whatever, is this something they have to do periodically, like the rest of their life?
Not necessarily. The goal is to do it once and hopefully get enough out of it and just keep an eye on you for years. The study I follow is out of France. They published their 15-year follow-up from the bone injection a few years back. They're coming up on their 20-year follow-up. They've shown that over low 80% is 82% or something of patients who have the bone injection were still doing fantastic at 15 years. Wow. So that implies 18% started having problems again. And can you do it again in 18 years or 15 years? Sure, you do it again if you need to. So, and now we do have a couple people that got like 50% benefit in their pain, and we're repeating the MRI and saying, oh, maybe they need a booster. So you might need more than one, but the goal is to do it once and only do what you need.
Yeah. And that's it. That's crazy. So when we're talking about like, how does one, do you have to be trained? I guess what I'm trying to ask, like, are there certain doctors you have to be trained in this? Like, how does one find doctors because not all doctors are doing this.
No, but we're around. You just have to, search, get on your web browser and search. You're not going to find advertisements. You have to look for websites. You can type in regenerative medicine, stem cells, what have you, and find someone near you who's doing it. Look, avoid surgery, that kind of thing. Make sure, if you're if you got a knee pain and problem, you see your regular doctor and ask, hey, what can we do with stem cell medicine? And if they say no, find another one to get that second opinion, that option, someone who will do that. We're out there. There are plenty of us. We see each other at annual different meetings and what have you. So
I love that. So what do you see? I mean, because you're going, you're looking at the research and you're going to these conferences. What do you see as, because I feel like the longevity piece, I was just having a conversation with somebody yesterday about this. I feel like this is kind of the new wave of like wellness is the longevity. Like people are recognizing there's so many factors working against us and like the toxic world we live in. Right. Yes. And so we're like, we're looking at longevity. Like I have a Pilates studio. Right. People are coming. It's not like, I want to do a hardcore workout anymore. It's like, I want to do what's nice for my body for longevity. So what do you see as kind of the future of what that looks like in terms of regenerative medicine and just anything else you see just for longevity?
Yeah. So great question. There are a few projects. First of all, we do have a segment of the patients who come in for, I'll call it health span treatments, IV treatments, or the recovering from a problem like a heart attack or a stroke, or they have their family history of dementia, early changes, they want to slow it down. Anything with an inflammatory component, the regenerative medicine will help suppress the inflammation. Most diseases of aging have an inflammatory component. Autoimmune diseases have an inflammatory component. Certain infections have a hyperinflamed component. like Lyme's disease or COVID-19, long COVID stuff. So we see that. So, but we have some people who are perfectly healthy who just want to stay that way and
Right.
as long as they can. So we do IVs. I do them myself personally, and I do it about 4 times a year.
Okay.
So, and I'm doing IV exosomes. And
Oh,
the first
nice.
one was a wow factor. And
Yeah.
every time after that, I think I have my inflammation suppressed. So
Mm.
I don't get so much of a wow factor in my energy and sleep and
Hmm.
cognition and stuff like that. But I have an attorney that likes to do it before a big trial. So
Oh, that's
his
awesome.
brain is sharp.
Yeah. Yeah.
I have some athletes, some high performers here in Las Vegas. We have a lot of dancers and performers
Hmm.
who do it so they can be at their peak. And people who track their HRV on their Whoop device or Apple Watch, we've seen improvements in that. We've seen improvements in biological age tests, inflammatory markers, and we do like everyone to be optimized first. So we recommend you're on a clean diet, good supplementation. You're getting all the anti-inflammatory supplements and vitamins, and we really push that. We're big fans of omega-3, like a lot of
Hmm.
omega-3 and
Hmm.
vitamin D3,
Yep.
5 to 10,000 units a day, that kind of thing. And then we appreciate people who at the proper age are looking to have hormone replacement with bioidenticals.
Hmm.
We want the cells to be most receptive
Yep.
for the stem cell or regenerative influence.
Right.
So we
Right.
don't want to just do it. We want to get you ready first, because if you're gonna do this, you should get the most out of it.
Yeah,
So
totally.
we do that. The other projects we're working on is one is for frailty in the elderly who are losing muscle mass and bone density. We do see improvement with the IV, but we are working to get what I'll call designer exosomes, some that will donate mitochondria to tissues to improve muscle mass and metabolism. And that's called mitochondrial transfer therapy. We're working on that. The other one is we're working with some specific type of immune cell exosomes that for the cells that can identify and cure cancer. So
Wow.
we're working towards help with that. That's not yet available, but stay tuned. It's coming.
That's amazing. That's
Yeah.
incredible. I mean, all of that is huge because I think that's one of the things, the other thing I talk about with my clients is the mitochondria piece. Like I think we're
Yeah.
hearing a lot about the mitochondria with people with, like we were talking about long COVID and that kind of thing, like the damage, like that's a big piece of the longevity puzzle, in my opinion. It's like,
Yeah.
keeping
Take
healthy
care of your
cells.
mitochondria
Yeah.
and they'll take care of you,
Yeah.
100%.
Yeah. That's amazing. That is really exciting. And I mean, essentially, you have the cure for cancer, like right there. So
Well,
that's really
we're
exciting.
working towards it. I don't want to make any
Yes.
claims.
I know
Don't get
you're
me in
not.
trouble.
I'm making it for you. I'm making it for you. I'll take ownership of that. This is awesome.
Whew.
I'll take the hit for you for that one. I love this.
Thank you.
So, what else? Do you have any other final words for people and just looking at just overall preventative things in terms of longevity and preventing disease and wear and tear on the body?
Yeah, you could stimulate your own stem cells, get out and exercise. Movement's the best thing. If you take care of if you take care of your muscles with weight-bearing exercise, they will take care of your bone density. So if you
Mm.
take care of those two things, both are associated with healthy longevity. So, and if you notice, if you go to a nursing home, most of the people there have a loss of bone density called osteoporosis, and they've lost their muscles called sarcopenia, where they're little old ladies and little old people there. So you don't want to be that, and you can avoid that. You can fight against it and delay it.
Yeah. Yeah. I love that. I don't know if you've seen, there's this study, and I've seen multiple Instagram videos about it, but it's the study about like the correlation between leg strength and longevity. And it talks about like the bones and the legs and how and it
Yeah.
talks about the stem cells and when you stimulate the bones of the biggest bones in the body. And so that it just made me think of that. We're talking
Yes.
about like the little old ladies who, and it's movement, it's working your bones and yeah, all
Keep
of that.
moving.
Yeah.
Move it or lose it.
That's
Yeah.
it. That's it. I love it. Thank you so much for this. I actually do have one more question I'd like to ask everybody as we wrap up. But can you just let everybody know where they can find out more about you and learning more about everything you're doing with the stem cell research, regenerative medicine?
Yeah. So my business name is ReCELLebrate because we're celebrating the renewal of your cells, and that's spelled ReCELLebrate. And you can find us on the web. We have a website with that name, Instagram, Facebook.
Perfect.
LinkedIn, Pinterest, TikTok, where that name is everywhere. That's
All
us.
the things.
Reach out. We like to meet new people. We have a lot of clients we talk to by Zoom or telemedicine and get them ready to see if they're candidates. If we can help you, come visit us in Las Vegas, make a weekend of it, and we'll get you taken care of.
I love it. Thank you. Of course, the links to all that will be in the show notes, so I can go check it out, give all the follows, go learn some new things. Okay, the last question I want to ask you that I ask everybody, what do you think is the most important thing you can do to live with purpose?
Well, I think that's different for everybody. And the first part is knowing what your purpose is. So I know mine is to help others with health. And I look back and I knew that when I was a child, really, and then you just, everything you do, at least professionally, should work towards that. So I think that you got to know your purpose, and sometimes people don't know their purpose. So find it, seek it, and then pursue it.
Yeah, I love it. Good advice to end on. Thank you so much, Dr. Gross. This is so good, so insightful, and I'm excited for the future of this. And I am grateful for your hard work and the community of doctors that you work with. So thank you, and excited to see what's coming next.
Me too. Thanks so much for having me.
Thanks for listening to Hopeful and Wholesome, y'all. If you found value in this week's episode, please subscribe on iTunes or wherever you listen to your podcast and leave a review to let me know what you thought. I'd love to know what you find useful in these episodes so I can know how to provide the most value I can to my listeners. And if you have topics you'd like to know more about, I'd love to hear those as well. So shoot me a message on Instagram, Facebook, or LinkedIn. It's @TheHopePedraza, or you can visit my website, hopefulandwholesome.com. Thanks, y'all.